Hello everybody, I'm Harry Akehurst and I'm a registrar in Gloucester. I'd like to talk to you about how we established and evaluated a new assessment unit for trauma and orthopaedics. Our on-call service receives acute referrals from emergency departments at Gloucestershire Royal and Cheltenham General Hospitals and several other sources shown on the right. We haven't previously had a dedicated assessment area, so patients were assessed in a busy emergency department or after admission to a ward. This negatively affected patient experience and safety, the efficiency of the on-call service, and patient flow across the hospital site. We trialled a new trauma assessment and triage unit called TATU, initially occupying a 6-bed bay on an orthopaedic ward. The unit was to be used to see acute ambulatory referrals and also for recovering trauma day cases and acute outpatient treatments and assessments such as once daily IV antibiotics, swelling and wound checks. The timeline is shown on the right. We gathered data between September 2019 and January 2020. Our evaluation of the unit involved collecting data on patients attending and obtaining feedback via electronic questionnaire from the orthopaedic and emergency departments and the site team. TATU received patients from diverse sources, but most patients were referred from our own emergency department. Approximately 25% of patients presented with trauma, 25% with infection, and 25% back pain or cauda equina syndrome. During the evaluation period, 648 patients attended TATU. We avoided over 300 inpatient bed requests, treated 71 patients with once daily IV antibiotics, and 92 clinic appointments were saved. Inappropriate uses of TATU were recorded for inappropriate trauma or as a pit stop for patients being admitted or discharged from inpatient beds. As shown on the right, we obtained feedback from a wide range of healthcare professionals in the orthopaedic and emergency departments and the site team. And this is the feedback from the orthopaedic department. Favourable responses are indicated by orange and red bars, and we can see that responses for safety, accessibility, quality of care, patient and staff experience were encouraging. Privacy was the issue with the fewest favourable responses, and fewer responses were favourable for inappropriate use and availability of resources. The emergency department was generally positive in relation to flow, timely care for orthopaedic patients, and knowledge of the referral pathway. Favourable or neutral responses were received whether TATU created additional work for ED staff or improved care for non-orthopaedic patients. It was not felt by ED staff that all suitable patients were transferred to TATU. The site team returned generally positive or neutral responses for the effect of TATU on patient flow across the site and resource consumption. Most responses were neutral on the impact of the loss of bed spaces to accommodate TATU, and most thought that TATU in its existing location could not be sustained during winter. We also obtained free text feedback and identified the themes shown. I will focus on inappropriate referrals, winter pressures and privacy. T&O staff felt that many inappropriate referrals or even transfers were made, usually from the emergency department and without acceptance from the on-call team. We continued to resist pressure to allow direct transfer from ED triage. Located in a 6-bed bay, TATU was felt to be susceptible to conversion back into an inpatient bay during winter. TATU has now been relocated to an adjacent area which cannot accommodate beds, and this vulnerability has been reduced. When located in a bay, several staff raised concerns that patients might overhear consultations, including intimate examinations, through the curtains. In its new location, however, TATU benefits from 2 examination rooms separate from the waiting area, and privacy is much improved. Overall, staff across all 3 departments agreed that TATU should continue. We have shown that TATU made a significant improvement to our service. TATU has now found a permanent home on Ward 3B. Thank you very much for listening.